Hi everyone, my name is Alex Sablesmith and I'm one of the third year family medicine residents here at the University of Colorado Family Medicine Residency. So I'm back with another Today in Clinic video. So one of the most challenging things about human physiology is that it happens to humans. We also have feelings and personalities and relationships. And no matter what field of medicine you may be in, we all treat humans. And so this fact is inescapable. So, in the 3 years of residency training, I've tried to master the art of giving the best, most up to date, evidence based treatment, all the while acknowledging the emotional turmoil, pain, and uncertainty that often walk hand in hand with illness. And in the time crunched environment of our medical system, sometimes it's hard to empathize with patients and even resent the emotions that complicate medical cases that are already really hard to grasp. So, one of the things that makes situations like this so difficult is often the powerlessness to address our patients' emotions and not feeling prepared to really handle that. Because really the thing is, I can figure out how to dose that medication, but sometimes I don't even know where to begin with the crying. So this is a daily challenge that I've found with endless room for improvement, I'm sure. And expertly addressing the whole person really does take a team with complementing skills. But what do you do when you have tears in only 10 minutes? You have to start somewhere. And there's something called the BATHE technique. BATHE stands for background, affect, trouble, handling, and empathy. So I'm going to go through each letter and give a sample question to elicit that information from the patient, and then give an example of a recent patient encounter that I had where I was able to use the BATHE technique. Before I begin, I should note that the BATHE technique comes from a book called The 15-Minute Hour, Therapeutic Talk in Primary Care by Stewart and Lieberman. So you note the emotional distress going on in a patient, as simple as getting the background. So tell me what's been happening. The example that I had recently was a patient who had had a pretty bad skiing injury, and she had also become pretty tearful in our follow-up visits. So I asked her, what's been going on? And what she told me was that she found out that the person who collided with her in this accident was back on the mountain and skiing, while her injuries had taken her out for the rest of the season. The next piece of information you want is about their affect. How are they feeling about the situation that they just described to you? So in our case, the patient was feeling very angry and also fearful about another accident. So now you have learned a little bit about the background and you've identified the affective component, the emotions involved in this. Then you want to get at what is troubling the patient most about this scenario. So in our case, what was troubling her most was the sense of injustice that she loved skiing and was so fearful of another injury that she didn't really want to go skiing again, while the person who had collided with her was out there potentially endangering other people. So next, simple enough, you ask the person, how are you handling all this? And you're able to get information about their coping mechanisms. So in our case, I found out that this patient was so fearful and angry, she was considering not even skiing again next season, which would have been a huge loss to her, as this was something she had done for her entire life and loved it. And then finally, you wrap it up by acknowledging and validating what the person has just told you. And keep in mind, this is even if you would have reacted differently in this situation, the person is experiencing these emotions, and you're going to work with that. So provide an empathic statement like, "I can understand how that would make you so angry." In my patient's case, it allowed us to take a new tact. based on this conversation, it really became clear to me that she was experiencing symptoms of PTSD. And so we were able to make the appropriate referrals and get her on the right track to recover from the emotional damage that the accident had caused as well. So I hope you found that information about the BATHE technique helpful. Stay tuned for more editions of Today in Clinic from the University of Colorado Family Medicine Residents.